The coronavirus pandemic has affected our lives, our economy, our health, and nearly every corner of the globe. The rapid spread of new variants offers clues to how SARS-CoV-19 is adapting and how the pandemic will play out over the next several months. WHO said the highly mutated Omicron variant of COVID-19 could change the course of the pandemic. Due to lockdown and work-from-home culture, people's lifestyles are already severely disrupted. Many people have become physically inactive and developed irregular eating patterns, which leads to unhealthier lifestyles and aggravation of lifestyle-related diseases. A multi-sectoral approach promoting healthier diets and increasing physical activity can help in slowing down the diabetic epidemic and heart diseases. Beat Diabetes Myths and Facts will impact and help a large number of people to prevent or control metabolic disorders. Today we have with us experts to share with you advice on leading a healthy life. Joining us on the show today is Dr. K. Venkata Umakanth, MBBS, MD Medicine, Consultant Physician, Capital Hospital, Vijayawada; Dr. Ranjan Kumar Sharma, MBBS, DNB Cardiology, MD General Medicine, DM Cardiology, Cardiologist, Manipal Hospital, Kolkata; and Dr. Suresh Suryawanshi, MD Medicine, DNB Cardiology, Fellow of SCAI, Fellow of ESC, Interventional Cardiologist, Suryawanshi Heart Care, Nashik. Thank you all so much, doctors, for joining on this very critical issue at this moment. Starting with you, Dr. Umakanth, the Omicron variant of the coronavirus has been spreading across the world at a remarkable speed. How many strains of COVID are there? Is COVID-19 variant Omicron worse than Delta?
The Technical Advisory Group on SARS-CoV-2 virus evolution, that is TAG-V, is an independent group of experts that periodically monitor and evaluate the evolution of this SARS-CoV-2 virus. They assess the specific mutations and combination of mutations and how the virus behaves. So now for Omicron, coming to Omicron, which is a SARS-CoV-2 variant B1.1.529. So the other variants initially which was first discovered was the Alpha in the United Kingdom, Beta in South Africa in May 2020, followed by Gamma, Brazil, and Delta, which was in October 2020 in India, which is B1.617.2. Now with the new variant is Omicron, that is the B1.1.529. So this variant has large number of mutations, some of which are concerning. Okay. So preliminary evidence suggests an increased risk of reinfection with this variant when compared to the other variants of concern. So the WHO noted that preliminary findings indicate Omicron infections, they may be less severe than the Delta, but the Global Health Authority added that it is too early to make firm conclusions on the severity of this virus.
Sure, so it is concerning. Dr. Sharma, tell us what are some of the symptoms of the Omicron variant of COVID-19? Are the symptoms same for people with heart disease as well?
Yeah, the symptom of various variants are almost same. The only difference is mainly your virulence, the incubation period, and the infectivity. The symptoms largely are fever, you can have cough, sore throat, like that, shortness of breath, loss of smell and taste. And the symptoms are almost same in all the variants of COVID-19 virus. The person having heart disease, they have a high risk of outcomes like heart failure or myocardial infarctions because of the stress due to pathological process and the thrombosis because of the virus itself that it can promote. Okay. Whether patient has got a heart disease or no heart disease, it can also involve the heart directly causing myocarditis. So persons who have heart disease in the form of heart failure or ischemia, they have higher chance of developing heart failure symptoms or developing acute coronary syndromes like heart attacks. Okay. And if it involves the heart in a healthy subject or patient having heart disease, the outcome is similar, there is myocarditis.
Okay, so the one needs to be still a little more cautious. Dr. Suryawanshi, as we all know, people with comorbid conditions suffered a lot during the second wave of the COVID-19 infection. Are people with heart conditions more at risk from the new COVID strain as well?
The answer to this question is yes. As it is applicable to any other, similar to any other viral infection, the people with chronic medical conditions, or we call it as a comorbid conditions, are more susceptible to developing infection as well as complication due to this newer Omicron COVID-19 strain than a healthier individual. This includes patients with pre-existing heart disease, strokes, high blood pressure, diabetes, kidney failure or liver failure patients. This also includes individuals suffering from chronic lung diseases like chronic obstructive pulmonary disease, pulmonary fibrosis, chronic bronchial asthma, and immunocompromised patients. And very important is the children and other people who are not vaccinated or partially vaccinated are also at the risk from this new COVID-19 strain.
Okay, so along with people who need to be extra careful, of course, those who are comorbid, even children and those need to still get their second dose or even the first dose of vaccination, again here is very important. Dr. Umakanth, type 2 diabetes is usually more commonly seen in middle-aged or older adults, but now there is a rise in cases of diabetes in the younger population as well. What factors contribute to the development of type 2 diabetes in young people, and which category of young people are at most at risk of developing type 2 diabetes?
Actually, in the past, type 2 diabetes was more prevalent in older adults, but due to the widespread of poor lifestyle habits, it is more common in younger generation nowadays than even before. So type 2 diabetes was usually called earlier as adult onset diabetes. Now this is becoming more common in children, so it's just called type 2 diabetes. So however, type 2 diabetes is rising incidence attributed in the past to pure lifestyle habits. There is a search study for diabetes in youth which studied around 5,300 people between the age of 10 to 19 over a period of 10 years, and they could see potential rise in the number of diabetic patients in younger children. And this study empirically states that by 2050 we can see 49% rise in the number of diabetic patients or diabetic people children getting diabetes between the ages of 11 and 19. So the risk factors affecting the children below the age of 18, most of the time is family history of any type 2 diabetes, first or second degree relative, being an Asian or Pacific Islander, any signs of insulin resistance, mother having gestational diabetes during pregnancy.
Okay, so those are some important points which you've pointed out, doctors. Dr. Sharma, tell me, heart attack and cardiac diseases have remained a major health concern around the world. But it is only recently that a rising number of heart attacks among the younger population are being reported. Like we were just talking about diabetes as well. What could be the reason for this?
Yeah, the causes of heart failure, heart attacks are mostly hereditary, but it is related to the lifestyle changes also. You can see there is a rapid growth of prevalence of diabetes, hypertension, dyslipidemia and obesity. This has happened in last 30 years or 40 years in India because of our development status has changed. The lifestyle of the patients have changed, persons have changed. You can see our dietary pattern in school children also. The lack of physical activity is very, very important. That is causing a lot of problems. And air pollution, which is also not, it's a neglected area, is again a very important cause of myocardial infarctions in young. So these remain a major thing, and I believe because of the poor lifestyle in school going children, we are going to see an explosion of this myocardial infarctions in young patients in India as well as in many of the developing countries.
Okay, so indeed a cause of worry. Coming to you, Dr. Suryawanshi, tell us, how does diabetes mellitus affect the heart? How can we prevent heart disease complication in diabetic patients?
Patients with diabetes are 2 to 4 times more likely to have a heart attack or a stroke than patients without diabetes. Heart disease is the #1 cause of death among people with diabetes. There are a number of ways the diabetes affects the heart. It's lead to formation of blockages leading to atherosclerotic coronary artery disease. Usually there are silent ischemias and multivessel disease in diabetes. Second way is it leads to affection of the heart muscle, leading to diabetic cardiomyopathy and heart failure. It also causes strokes, that is paralysis. It affects the peripheral arteries, leading to peripheral artery disease and the kidney disease. In order to prevent the heart complication in diabetic patients, we should know and manage your diabetes ABCs. The A stands for A1C test, that is a glycosylated hemoglobin test, which should be less than 7. B stands for blood pressure, as adequate control of the blood pressure less than 130/80 is important. C stands for cholesterol, which should be controlled. Patient need to stop smoking, stress has to be reduced. They need to take regular medications which are prescribed by their doctors. Eating a good heart healthy diet is very important. One has to eat more fresh fruits and vegetables, and exercising regularly is very important.
So at this point, I mean, managing diabetes is really, really important, and managing it well, and specifically if we talk how it affects the heart. So on that note, we're going to be taking a short break. We'll be right back. Welcome back. You're watching Beat Diabetes Myths versus Facts. Dr. Umakanth, the prevalence of diabetes is increasing due to multiple reasons. Can the 90-90-90 program, can that be a solution to this problem? Will it really help to reduce the prevalence of diabetes in our country?
Yeah, the prevalence of diabetes is increasing due to many reasons which we have discussed earlier. So coming to the 90-90-90 approach to prevent and manage diabetes in India, wherever it is possible, this will be the first time such a method can be applied to diabetes, and I believe it has a potential to change the trajectory of this disease in our country. So coming to the 90-90-90 approach, it works through education, creating awareness, implementing it, which would mean that in 90% of Indians who are at risk of living with diabetes would know their status. 90% those diagnosed with diabetes or pre-diabetes would be benefiting from healthier environments and appropriate treatment and management of their disease, and 90% of them would be experiencing the improved outcomes, and 90% will be free from the complications of diabetes. So this would also mean that millions of Indians who currently are on track to develop diabetes would not. So millions of Indians with diabetes who are at risk of developing serious complications like blindness, renal failures, diabetic neuropathies, nephropathies, retinopathies would see a much reduced risk of developing these complications, and millions of rupees might be saved by our healthcare system.
Dr. Sharma, tell us who is the right candidate for angioplasty and who needs a bypass surgery. Could a bypass surgery, which is CABG, be a better option? Because sometimes there's a lot of confusion on this, that which one should one opt for?
If we look at the journey of revascularization is either angioplasty or bypass surgery. It started with patients of stable ischemic heart disease, means patient having angina on exertion. They used to be offered this management only once the medical treatment used to fail. So still the guideline says that if the patient continues to have symptom in a stable patient, then we require either bypass surgery or a angioplasty. But in acute coronary syndromes, means once a patient develops heart attacks, in that condition 99.9% of cases we go for angioplasty only.
Okay.
For stable disease, once we are offering both, either angioplasty or bypass, which one would be better? It all depends on the anatomy of the disease.
Okay.
We have evolved a lot in terms of angioplasty successes because of very good quality of stents and hardwares. We can almost go for angioplasty in a good number of cases. Very small percentage of patients having very heavily calcified vessel or disease at the bifurcation points in left main system. In those persons only we offer them bypass surgery.
Dr. Suryawanshi, what are the signs and symptoms a patient should be aware of post-angioplasty? What do you think, in case of an emergency, what should one do?
Yeah, once the patient undergoes angioplasty, patient should take his medicines regularly. Usually he is on a blood thinner medication like aspirin and a cholesterol lowering medication like statins. They are mandatory as they prevent important life threatening complication. Patient should follow a heart healthy diet, as well as diet should be in a moderation. He should be doing moderate aerobic exercise. He should go for regular follow-ups as prescribed by his doctor. And most important, he should not ignore or hide symptoms like unusual chest pain, breathing difficulty, hyperacidity or dyspepsia, or a symptom similar to those occurring before angioplasty.
Okay.
No symptoms should be ignored, as any complication in these patients can be life-threatening, that is a stent thrombosis.
Okay.
And in case of emergency, if the post-angioplasty patient develops any of these symptoms, please do not ignore or hide these symptoms. Even if it occurs at occurred time or location, it is always advisable to get an electrocardiogram done and consult your treating cardiologist immediately.
So I think that's a very important message out there, that do not ignore any symptoms. Dr. Umakanth, is only blood sugar control sufficient for the effective management of diabetes? If not, what other factors should be controlled?
No, not only the blood sugar, your lifestyle modifications, your diet, your health, exercising, other blood pressure monitoring, cholesterol monitoring, and control of blood cholesterol levels also is mandatory to have diabetic free and complication free.
Okay, so I mean these things are all important, not just medication and controlling sugar, but like the important points what you said.
First thing is always exercise, next diet control,
Okay.
then only it will be the medications.
Okay, so exercise, diet control, of course, and then we handle it with the medication. Dr. Sharma, tell us, since decades, aspirin is being used to prevent and manage heart disease as well as stroke. What is the role of aspirin in the treatment of clotting in blood vessels?
Yes, aspirin is time tested.
Yes.
Is widely available, very cheap and very effective for prevention of blood clots in the arterial system of the heart as well as in the brain. But it is less effective for venous thrombosis. Recently we have few medicines which have been shown to have very good effects in prevention of these types of problems. But these drugs are costly, and I still believe that if you look holistically in a developing country where the fund resources are limited, I still believe aspirin will have to have a very good role in decades to come.
Dr. Suryawanshi, what really is the role of cardiac rehabilitation post-angioplasty, or if I could ask you, a bypass surgery? Does home cardiac rehabilitation, does that work? Is it even possible?
The cardiac rehabilitation is a medically supervised program. It is designed to improve cardiovascular health if you have experienced a heart attack, heart failure, or have undergone angioplasty or bypass surgery. It is a customized outpatient program of exercise and education. This is designed to improve your health and recovery. It has essentially three important parts. The first one is exercise, counseling and training. Second one is education for heart healthy living. And third is counseling to reduce the stress.
Okay.
So over a long term, sticking to a cardiac rehabilitation program improves strength. It helps in adopting a heart healthy behavior. It helps in cutting habits, bad habits like smoking and tobacco. It helps in managing your weight, and it helps in finding ways to manage stress.
Okay.
And learn to cope up with the heart disease. With this, it helps in reducing your risk of coronary artery disease and other heart diseases. So it's very important and mandatory to have a good cardiac rehabilitation program that is there.
Okay, so cardiac rehabilitation program is important. Thank you so much, doctors, for joining us today on this very important issue we've been discussing. And I think what we've really understood is that we need to manage diabetes well, whether it's controlling our blood sugar, but I think like all of you said, it's about holistically managing the disease. Thank you all so much for watching.